The Cavalry is finally coming over the hill, with vaccination programmes now being rolled out in the United Kingdom, in Russia and in China. We asked Professor Luke O'Neill of Trinity College Dublin and Dr. Chris Smith, the man who on this programme forecast a pandemic at the start of the year, has the end of the pandemic finally come? Join us on the Alex Salmond Show, on air and online.
Welcome to the Alex Salmond Show. The vaccine cavalry is coming over the hill and not a moment too soon. This week, vaccinations against COVID started across the United Kingdom, where the 4 administrations are all struggling with containing the virus while sustaining the economy. In England, open political revolt has broken out in the ranks of the governing Conservative Party, and public dissent was reflected in ugly scenes in the streets of London the weekend before last. The national lockdown in England has come to an end and been replaced by an area system, which keeps the vast majority of the country in an effective lockdown. But while in England, Scotland and Northern Ireland, new COVID cases seem to have stabilised, in Wales they continue to increase. Even where the 4 governments have agreed to a joint approach to the 5 days of Christmas relaxation, there is substantial controversy, with many scientists warning that the human cost of Christmas celebrations later this month could be high in January and February. Today, we ask 2 top experts how things are shaping up for the festive period and whether it is sensible or foolhardy to permit such celebrations. And we ask whether it is now plain sailing for an effective vaccine programme or whether there are still potential pitfalls to come. But first, to Alex, with your reaction to our recent tribute to the late John Hume and our show on Scotland's National Day, St Andrew's Day.
IM says, Sir George Reid got me involved in politics in 1979. To my mind, he was the greatest MP this country, that's Scotland, has ever seen. At 82, he still talks more sense than many of the Muppets involved in the Scottish and Westminster governments today. And Shirley Ann Seaton says, your interview of Sir George Reid was enlightening en route to independence for Scotland. I was particularly interested to hear that Professor Sir Neil MacCormack, a great figure of the national movement in Scotland, Professor of Constitutional Law at Edinburgh University, European MP, that Neil MacCormack had drawn up a constitution on the basis of, here's one I made earlier, isn't it time to pull it out for any re-icing? And Pilar Fernandez says, St Andrew's Day, learning a lot from Billy Kay, one of our guests in the programme. Christina Fisher says, I just feel that Bojo, that's the Prime Minister, has let his mask slip and allowing his disdain of Scots who want to diversify from old political agendas to show. Andrew Northwell says, fascinating to hear of the connections between Scotland and Russia. One's the country of my birth. He doesn't say which one. And Tasmina's summing up of the show where we talked about how you can't sit in a thistle. It's described as a dual dagger between the shoulder blades. Beautiful, exquisite, perfectly poised and deadly, and all with a smile. And Lynn Finlayson, moving on to the John Hume show, it said that was a fascinating and moving tribute. I well remember the troubles in Northern Ireland. It is disgraceful that Brexit threatens the peace. Alistair MacDonald was right to say that nobody trusts the British government, to which in answer Fleur says, difficult to say whether that's a flaw or a feature. Now back to Tasmina.
At the beginning of this extraordinary year, when the President of the United States was making fun of the virus and the Prime Minister of the United Kingdom was not even attending the COVID briefing meetings, Dr. Chris Smith, the Cambridge virologist, warned on this programme that we were facing the gravest of public health challenges. Now, with the first vaccines arriving, Alex discusses with Dr. Smith and Professor Luke O'Neill of Trinity College Dublin if we can be sure that an effective vaccine will bring this nightmare to an end.
Professor Luke O'Neill, Dr. Chris Smith, welcome to the Alex Salmond Show.
Thank you.
Now, this is very much the week of the vaccine, the first now being approved and deployed in the the United Kingdom, 2 more coming up. In Russia, the Sputnik vaccine is being rolled out, and China seems to have not 1 but 2 vaccines. So, Chris Smith, you're the man who predicted at the start of the year that the pandemic was coming on this programme. Can you now tell us it's coming to an end?
I hope so. I think this is a wonderful triumph for science, isn't it? Here we are, less than a year after we first discovered this virus existed, and we've got the genetic code, we've understood its biology, and now scientists have invented not 1 but possibly 40 different vaccines. There are 3 which are nearing the finishing line in the UK. This is really exciting, and not just really exciting science but really exciting medicine. These things look to be very, very effective. Let's hope they're really, really effective in the really long term. But for now, if we can carry on this trajectory, then yes, I think this is, as Boris Johnson said, is the beginning of the end.
Look, Neil, you're in a slightly different position in the Irish Republic. The approval of the first vaccine isn't through yet, different regulatory authority. On the other hand, your COVID cases at the present moment seem to be a bit more under control than they are in the nations of the United Kingdom. Would that be a fair summary?
It is, Alex. We're doing great, by the way. Ireland's got the lowest rate in Europe at the moment, the Republic, which is fantastic. The 14-day average count is way down. We went into what's called a level 5 lockdown here, which is quite strict over the past 2 weeks, and it's worked. We've got the virus count right down. And you've got a very strange situation, Alex, where someone's taken a vaccine in the north of Ireland, right? A woman was vaccinated today, and yet we can't get the vaccine in the south. I mean, there's a strange geographical anomaly for you, isn't it? You know, clearly we're with the EMA. We're waiting for the EMA to give its opinion on this vaccine. We've no doubt the EMA would approve. I'm sure Chris would agree. The EMA and the FDA would approve this Pfizer vaccine. It's just a question of when now. But isn't it strange, Alex? One part of the island is vaccinating, the other's not. The virus doesn't care which part it's in. You know, we have the vaccines being used in the north.
Chris Smith, you said the Pfizer vaccine, the first to be approved, is a different type of vaccine. Is that going to cause any public concern? Are people not going to be saying, well, maybe I should just wait for the Oxford vaccine, which is a much more conventional style of vaccine? Would that be an issue?
Well, we don't know that we're going to have this vaccine from Oxford yet. We don't know it's absolutely going to be delivered in terms of approval. So therefore, at the moment, we know we have 1 vaccine which has been approved by the MHRA, is judged to be safe. It's judged to be very effective, at least in the short term. So therefore, it seems to me that the most sensible thing to do at the moment is to use the one that we do have. It's any port in a storm.
Look at Neil, is Ireland and indeed the rest of the European Union, are you also looking at Pfizer, Moderna and Oxford, or other of the 40 or so vaccines that Chris Smith indicated that might be the ones who are deployed in Ireland?
It is remarkable, Alex, as Chris said. I mean, to have all these vaccines now at hand is an incredible achievement for science and medicine, obviously. There's at least 8 predicted by, say, June of next year that EMA could well approve. Same order as the MHRA, of course. We'll see the Pfizer one. Moderna will be next. Probably AstraZeneca, although that got caught up in a couple of things the other week. But that's a very effective vaccine. It's found to work very well. Then you've got Sanofi. They're coming up, Johnson & Johnson, Novavax. And then, as you mentioned, Alex, there's the Russian one, which seems to be highly efficacious, and the Chinese one. So one prediction is by the middle of next year, there may be as many as 8 vaccines available for use in the European Union. I've no doubt that the MHRA will have a similar number approved as well. And the question then becomes, which one do you use? I mean, some are more convenient. The storage issues are less stringent with some than, say, as we all know by now, the Pfizer one needs an ultra cold storage. And then there are old-fashioned technologies, by the way, which are also being deployed in some of these other vaccines. So it's going to be very interesting to see what happens in terms of which ones get used where.
Chris Smith, these issues with different types of vaccine, can the authorities really have the luxury of waiting for? Don't they just have to take, as you said, what's available and get on with it, as opposed to waiting for the perfect vaccine for their circumstances?
Yes, quite right. And here we are with the world paralysed by a pandemic, and we want to get back to as near normal as we possibly can as soon as we can. And what is holding the process up at the moment is just that there is a difficulty making enough vaccine. We're talking about vaccinating an entire world population. Some vaccines are going to be much more useful in certain settings. And by that, I mean, if you've got a vaccine that needs to be kept at minus 80 degrees, it won't be any use whatsoever in a country that doesn't even have a reliable electricity supply, let alone minus 80 degree freezers. Similarly, if you have a vaccine which is very, very good at surviving in the field, but might be a little bit less efficacious, then that's actually arguably a much better benefit and a much better prospect to use that in a poorer country where actually survival of the agent, when you can't keep it in the fridge, really matters. So actually the more horses we've got in this race, the better as far as I'm concerned, because it means there's more supply chains, there's more reliability of supplies, and there's more scale, because at the moment the bottleneck is making enough of the stuff fast enough.
And look, Neil, are the Irish government, indeed other European governments, are they set on the same progression of Pfizer, Moderna, Oxford, or might they be ringing up Beijing or ringing up the Kremlin saying, do you have a few million spare doses that you can give us? I mean, how open is the field in this? Do the Irish government, for example, have a good take on which vaccines they're going to be distributing when to their population?
Not really. It's like Chris was saying, Alice, in a sense. I mean, it will be stepwise. The Russian one's interesting because that's now being widely used in several countries. One of the Chinese vaccines is in the Middle East and in Morocco, you know. So we're going to have millions and millions of people being vaccinated with all these vaccines, and they will hopefully release the data. And then you might, as Chris says, you might see a more efficacious vaccine in a different population. Maybe you know, younger people might respond well to one. You know, there's all kinds of questions that will now be answered. It's a remarkable period ahead of us, Alex, because the science of what we call phase 4 is going to be really interesting. Now, phase 4 is when it's approved. And then you do pharmacovigilance, it's called. And there's going to be very close monitoring of the main vaccines in terms of responsiveness. So we're going to get a huge amount of data in the coming months. And we may finesse then which vaccine we'll actually use.
Chris Smith, I mean, people talk about vaccinating a whole population, but I remember speaking to Professor Harry Burns in an earlier show, and he pointed out to me, in conversation at least, that, look, in this middle of the Second World War, the entire population of Glasgow was vaccinated for smallpox in the space of a week or two. So is it really such a huge logistical exercise to vaccinate a whole population when you have the full health infrastructure as the nations of the United Kingdom have?
Well, there are a number of challenges to doing this. Not everyone's mobile, not everyone can get to a vaccination centre, not enough vaccines can be made available quickly enough, not enough people are available to give vaccines. So organising those sorts of movements, mass movements of people, mobilisation of vaccines, trained staff, etc., it is a logistical headache, not because it's impossible, but because we don't have a simple track record of doing that. The entire world is susceptible to this. This is a global problem that needs a global solution. That global solution is to offer vaccines to everybody everywhere, because as Melinda Gates of the Bill and Melinda Gates Foundation very accurately put it, if there's COVID anywhere, there's COVID everywhere, because it will seed itself back and come back with a flourish if we give it the opportunity.
Professor O'Neill, how should the authorities face up to the anti-vax movements in various countries and on the internet? I mean, it's unlikely in liberal democracies that the vaccine would be made compulsory, unlikely. So how should the authorities best face the arguments to persuade the population to be vaccinated in the numbers that deliver the herd immunity that Chris Smith was talking about?
Very hard to handle anti-vaxxers because, you know, and there's only a very tiny minority are anti-vax really, you know, and one policy is just to ignore them really. A second one is you worry about the moderates who are hesitant. They're the ones to focus on and they're the ones to convince. And that may be as high as 30% or more because it's a new vaccine. We don't know the long-term safety profile yet. Now, what we're doing in Ireland is very simple. You start by saying, look, this vaccine is about protecting the vulnerable. That's what this is actually about. And that's why we vaccinate the people over 60 and over 70, because most of the deaths are in that age group. But if you can imagine, Alex, if the death rate goes down to 0.05% or whatever it's going to be, that's a tremendous achievement because the fear now begins to go away from this disease. You can open up society more and more because it's no longer a lethal disease. That's what this is actually about in the first phase of this. And all you can do is appeal to people's sense of community and their sense of reasonableness, I suppose. I think it's also important to say, Alex, give them the data. We need a lot of transparency here. So the FDA today actually have just issued lots of data on the Pfizer vaccine, which anybody can read, you know, and you say, here's the safety data, here's the efficacy, now please vaccinate. And you can't make it mandatory because that just drives people demented on, you know, civil liberty people and so on. So it has to be voluntary vaccination. The last thing you might do is give people a choice. So, for example, you might say, if you want to go to Australia, you will have to have a vaccine. If you choose not to go, that's fine, you know, and let them make a decision there. So those kinds of things are now being discussed extensively. In Ireland, I'm on the actual vaccine advisory group to the government. They have a special communications committee who will now begin to, you know, make arguments to try to convince vaccine hesitant people to vaccinate. So it's very much an active and extremely important question.
Join us after the break, where we'll be asking our two top experts whether Christmas celebrations with the vaccine cavalry coming over the hill are entirely sensible. Join us then.
Welcome back. Alex is in discussion with Dr. Chris Smith, managing editor of the Naked Scientists website, and Professor Luke O'Neill, Professor of Biochemistry at Trinity College, Dublin.
Chris Smith, you've been talking about the concept of a common sense Christmas. I mean, what do you mean by that amid this controversy in the UK and indeed in Ireland about whether it's entirely wise to loosen regulations just when we might be seeing the end of the pandemic?
Well, I was trying to trump Scotland's Jason Leach, who told everyone to prepare for a digital Christmas. When it became clear that we were going to be having some semblance of Christmas, it was important to emphasise to people that this, in the same way that many ministers then came out and said, this is not a target, it is a limit. And if you don't want to get together and celebrate Christmas, you're not obliged to. But if you do decide to go ahead, please be sensible. So what I'm trying to advocate for is a common sense Christmas. Really use your common sense. We know who the vulnerable members of society are. We know who the people in society who are more likely to have the infection at the moment are. The people who are most vulnerable are older people, people who are male, people who have pre-existing health conditions. The people who are more likely to have the disease at the moment, whether or not they're ill with it, they're certainly potentially infectious, are younger people. School-aged children are the biggest group at the moment. For obvious reasons, they have more contacts with other people. So if you're planning on having a get-together at Christmas, it would be sensible, if you have older members of your family or people in frail health, not to invite them to come and have Christmas with you this year. Wait until next year when A, they've been vaccinated, B, the level of disease circulating in society in the community is very low, and that will make a much safer Christmas. Have your Christmas like they do in Australia. Have a Christmas in July, as I celebrated a few years ago when I was there. And that can actually be a good thing to look forward to, but it minimises the risk. On the other hand, if you've got very young, fit members of your family and you just want to celebrate with them, you're much less likely to have ensuing problems as a consequence of that. So that's really what I was advocating for. Use your common sense in terms of who you mix with and try to minimise that mixing to the greatest extent possible.
Now that seems clear enough, Luke O'Neill, but aren't the politicians in danger of mixed messages in both the United Kingdom administrations and in Ireland by saying we're having this Christmas celebration? Isn't that effectively an invitation for people to gather together and to pass on the virus just at the point where you might see the end in sight? What do you think in Ireland, where I think you're having an even longer Christmas than they're suggesting in the United Kingdom?
This may sound strange. We have sympathy for our politicians to some extent because it's very tough for them to call this one. Because if they were to keep it stringent, people will break that anyway because people are desperate to have some relief from this year. It's been so tough for so many people. So they took a pragmatic approach and they said, right, three households can meet on Christmas Day, seat separately, sit with your own household, only one person in the kitchen. You know, there's a very interesting list of guidelines of how to have a safe Christmas, just cognizant of the fact that people are going to mix and mingle. The pubs are saying closed, which is a tragedy for Ireland, as you know. Alex. They haven't been open since March. The fear here is gathering at shopping centres and on streets and so on. There's a mask mandate in shops. Wear your mask on the street even, you know. So they're trying to limit the damage.
Chris Smith, why have some countries managed to implement test and trace and some countries haven't managed to hit the mark?
Well, first and foremost, this is a really tough disorder to get on top of. And the reason it's a really tough disease to get on top of is, as some studies have confirmed, up to 78% of people who are infected with this coronavirus may show no symptoms whatsoever. When you've got, as we did do in recent months in the UK, 100,000 cases a day, each person will have maybe 5 to 10 contacts across their period per day, and that means you might be trying to trace down an impossible number of possible contacts. There's just not the testing capacity for a start. This is not something that just the UK is guilty of. This has been a major headache for many countries and many jurisdictions around the world that have found how tough this is to keep a lid on. And that's why it has brought many of the most developed economies in the world to their knees.
Look, Neil, you mentioned earlier on that the Ireland's figures in recent weeks have looked pretty good in European terms and indeed in comparison with the United Kingdom countries, after having a fairly similar pattern in the early courses of this pandemic. Can you put your finger on what exactly has happened in Ireland in recent months that have allowed the disease to be better suppressed in recent times?
Well, again, it's a remarkable performance from the Irish people, Alex, to be honest. I mean, we're very proud of ourselves in a way because people did comply with the guidelines, broadly speaking, you know, and it was very simple. But the message, but they got the message out quite reasonably. And see, in August, September, the numbers began to go up like elsewhere in Europe. But the public health messaging was very strong. You know, avoid the 3 C's: closed spaces, close contact, you know, crowds. That's the simple guideline in many ways. And then the Irish people managed to do that, it looks like. And then the numbers began to fall. The second thing I like to say is we have been telling people the cavalry's coming and look at what's happening, you know. And like the idea there would be, why would we let people die and get really sick when there will be vaccines? And people, I think, have responded to that message quite well as well.
And are you taking some of these lessons through in your forthcoming book? I mean, there's elements of the pandemic that you're putting your finger on and saying, these are the things we've got to learn for the future. There
is indeed. Well, my book is called Never Mind the Bollocks, Here's the Science, you see. And it's actually out. It's on the market. It's selling quite well, I must say. And I've got a whole chapter on vaccines, actually. And I wrote it before COVID. I did the proofs during COVID, so I was able to add COVID references in. But the book is actually about using science to help us. And I think the second thing I would say about the Irish people, there's a level of literacy here, scientific, that's amazed me. And I've been asked to do some media stuff, and I'm amazed at the level of scientific literacy here. So, and the book is saying, look, science is our friend. And here's the case for vaccines, for example, as one topic in the book. So it's been quite timely, actually, the book has come out when it did.
Now, in the Naked Scientist platform, Chris Smith, what are the essential lessons you and your colleagues are taking out of the experience so far in this extraordinary pandemic?
Well, it's been an unusual time for me, hasn't it, I suppose, because here I am as a consultant virologist. I work as a doctor diagnosing people with virus infections, and I teach at Cambridge University about pandemics and where they come from. And at the same time, for the last 20 years, I've been making science radio programs, podcasts, and occasionally television programs. And so it's been a unique fusion for me of a doctor who works on viruses and knows a bit about coronaviruses, and also knows a bit about the media and has a media platform. If I'd had to sit in my living room and watch Netflix or whatever for 6 months, I think I would have gone stir crazy. So I'm very grateful I have had the kind of ferociously busy schedule that I have, because it's kept me sane. And I feel very sorry for people that have lost livelihoods and lost their sanity in some cases during the last 6 months. It must have been absolutely terrible for them.
And look, Neil, finally, is that the sort of message that is going to get across in Ireland and across the European Union countries, that the science has to prevail after this huge tragedy, that there will be a concentration of saying, look, these are the lessons that are learned, they must be learned, and they must be ready for implementation when the next pandemic comes?
Exactly. I mean, what happened with SARS, remember, and MERS, those countries that had SARS, they could respond much more quickly and put the fire out more quickly for COVID-19, you see. So we will be ready next time. That's one thing that will happen. I think there'll be more preparedness. But more importantly, I think, Alex, the biggest benefit, in my opinion, is new vaccines, because these new technologies were brand new. The RNA vaccine approach, it had been tried for a number of years, but now one has been approved. It's a very powerful vaccine, this Pfizer vaccine, so will Moderna, and indeed the Oxford technology. They were going to use that against cancer, remember, different types of cancers. So I think one of the big benefits is this science that we've learned in this period could be deployed with other vaccines down the line. That may be the biggest benefit. And lastly, my own area, I work on anti-inflammatories. My lab works on COVID, just behind me here. We got 4 projects on new anti-inflammatory approaches to protect people in COVID. Now, if COVID goes away, or not goes away, but certainly is manageable, what we discover on the inflammatory process could be applied to other inflammatory situations, you see. So I'm optimistic that we'll see a lot of medical breakthroughs coming off the back of COVID-19.
And Chris Smith, finally, would that be a bright note in which to end this very, very dark year?
I think this has been a triumph of science. It has demonstrated what can be done when we put our minds to it and how ingenious people are. We've gone from never having met this pathogen before to identifying it, working out how it causes disease, developing a vaccine, and then developing ways to produce that vaccine, and not just any old vaccine, vaccines that work in brand new ways, new science, new technology, which will have a lasting legacy and which are going to save lives into the future in a range of different ways and for a range of different reasons. So I think there's every reason to be optimistic now for 2021.
And would that mean, both of you very briefly, that public health and the advance of science have to go hand in hand, so that when a new pathogen, pandemic emerges, that the public health can control it till the science gets a grip of it, in a phrase?
Absolutely, Dice. I mean, that's the beauty of this. There will be an investment in public health now at last, and there hasn't been for years, really. That will improve. And it won't just be about infectious diseases. Public health traditionally was in many other diseases as well, you see, to protect the people. I mean, overall, for me, it's a triumph of science and medicine as a way to protect our people through all these different things we've been discussing. And at last, we'll get a handle on some of these things into the future as well, which people have been crying out for years anyway. So I agree, because I think that the future has to be seen as optimistic from what we've learned, and not downplaying how serious and difficult it's been. It's been a very tough year in so many ways, but we can definitely look more optimistically towards 2021. On
that optimistic note, Professor O'Neill, Dr. Smith, thank you so much for joining me on the Alex Salmond Show.
Thank you.
Thank you very much.
Many European countries have struggled to contain the second wave of the deadly virus. Nowhere is this more true than the 4 countries of the United Kingdom, where dissent against the apparent contradictions in their public health approach has been growing. No doubt, the post-pandemic inquiries will be able to explain why the countries which invented public health were incapable of controlling a modern-day virus, as, for example, South Korea and New Zealand have done. Fortunately, and thanks to brilliant scientific work internationally, the vaccine programme is upon us. Although it is to be hoped that the organisation of the rollout will be more effective than the test and trace systems in each country. The arrival of the vaccine has lifted the mood of a population growing increasingly restive of onerous restrictions. Much debate in recent weeks has been on the proposed Christmas relaxation, where politicians seem to be licensing human interaction, which their own experts tell them will result in an inevitable surge in cases, just at the very point where the vaccine arrives. There have been more than 60,000 deaths in the United Kingdom, one of the highest casualty rates in the world. Hundreds of thousands of others will suffer long-term disability. Many, and not just those of us, whose immediate families have been touched by the tragedy of this appalling disease, find it difficult to comprehend why the Christmas festival could not be marked in a more common-sense manner compatible with public health. The bottom line argument from the politicians seems to be that people would go ahead anyway. But that sounds like an abdication of leadership. Why would people not respond to leadership which says that family celebrations could be delayed until it's safe to do so? That perhaps there could be a longer celebration of Christmas and Easter together? Who knows? It might even allow room at the end for the underlying messages of these great religious festivals to be better considered and understood amid Thanksgiving for those who have survived. But for now, from Alex, myself and all at the show, stay safe, and we hope to see you all again next week.